Honourable Speaker and Your Excellency, the Honourable Speaker, the Honourable Prime Minister, the Honourable Cabinet Ministers, Honourable Leader of the Opposition and Honourable Members of Parliament, and also those from around Fiji who are listening in and watching today. I rise to give a ministerial statement on the COVID-19 update, what the strains are doing around the world, and our current vaccination process. Honourable Speaker, it's now been exactly 1 year and 6 days since Fiji recorded its first case of COVID-19 on March 19, 2020. And we look forward with anticipation for April the 19th, which will be 1 year since we last had a case picked up in the community. Since our first case was reported, Fiji has now had 67 cases, 64 have recovered, and 2 deaths. And as we are all aware, the 2 deaths were border quarantine cases, our fellow Fijians who have come back and unfortunately succumbed to COVID-19. The last 49 cases have been international travel associated cases detected in border quarantine. It has been 341 days since the last case was detected outside border quarantine on April the 18th, 2020. As of today, we have conducted a total of 35,986 laboratory tests with a daily average of 234 tests over the last 7 days, a weekly average of 1,609 tests per week over the last 2 weeks. Our testing capability now stands at 484 tests per positive case diagnosed, with a ratio of 40 tests per 1,000. And we are seeing the continuing increase in testing ratio as our capacity to test continues to improve. Since the last update in this August House, we can now test for COVID-19 at Lotoko Hospital, Lambasa Hospital, in addition to the Fiji Center for Disease Control at Tamavua. But the good news is, a year down from our first case, Fiji still remains COVID contained. As of yesterday, Honourable Speaker, the total number of cumulative cases in the Pacific was over 30,000, with the following countries continuing to be worst affected: French Polynesia with 18,500 cases and over 140 deaths, Guam with 7,500 cases and 134 deaths, and Papua New Guinea recorded a 20% increase from my last update with 3,700 cases and 37 deaths. And this, Honourable Speaker, is a worry for us. The challenges that Papua New Guinea is going through, especially as we have Fijians still in Papua New Guinea. I note that there is a repatriation flight that's been organized, and I make a call for all Fijians who are in Papua New Guinea, if they're able to come back home here to Fiji. There continues to be a large community transmission in these countries, while Wallis and Futuna, like Fiji, has imported cases totaling to 338 and 2 deaths. Just recently also, Honourable Speaker, we've seen that New Caledonia, which has had a fantastic COVID-19 containment period similar to Taiwan and Fiji, had also had COVID-19 picked up within the community. And so the Ministry continues to closely monitor the global and regional scene of the pandemic and regularly engages with experts in the country and abroad to ensure that we are well informed of the developments. Over the last 4 weeks, there has been another surge globally in the number of cases, with over 123 million cases of COVID-19, with more than 2.7 million deaths reported today. Cases continue to increase, with almost 400,000 cases and over 7,000 deaths over 24 hours. Daily case numbers range from 300 to 400,000, and daily deaths range from 7,000 to 10,000 globally. For infectious diseases, every time there is a community transmission, the likelihood of the virus mutating increases. The longer that the virus lingers within the community, the likelihood that a mutant form of the virus can form. And that's our continuous worry, because we have, obviously, as you understand, we are repatriating our fellow Fijians from all over the world. There are concerns with some of our countries in Africa, and as you know, the variants which I'll talk about soon. Most viral mutations have little to no impact at all in its ability to cause infection on people. But depending on the changes to virus properties, as a result of the mutation, it may change the virus transmission rate and its severity. There are many variants of SARS-CoV-19 as a result of the mutation, but 3 are currently variants of concern. The UK variant, the South African variant, and as recent, the Brazilian variant. And I was reading early this morning that there is a double mutant variant picked up from India. And that is one of the reasons why the Indian government has also indicated that it wants to lower the exports of Covishield, which is the AstraZeneca vaccine that's being produced in the Serum Institute in India. We've also noted reports in France and as of variants, and also, as I've alluded to, the Indian variant. Studies show that these variants spread more easily, more transmissible, up to 70% more transmissible than the actual virus, the original virus, and they may be associated with an increased risk of death compared to other variants. Essentially because more people can get infected, and as more people get infected, the likelihood of more people being very sick is higher, and the likelihood of more people dying is higher. The COVID-19 vaccines that have been approved and those currently in development are expected to provide at least some protection against new virus variants because these vaccines show a wide immune response. Therefore, changes or mutations in the virus should not make vaccines completely ineffective. The authorities in the affected countries are conducting epidemiological and virological investigations to further assess the transmissibility, severity, risk of reinfection, and antibody response to new variants. While science has proven that the new vaccines will provide some defense to the COVID-19 virus, rigorous and increased compliance with public health mitigation measures, such as physical distancing, use of masks, hand hygiene, and isolation, remains the top of the defense mechanism and is essential to limit the spread of the virus and protect public health. Fiji has been preparing well before the virus reached our shores. We're one of the first nations to introduce the supplementary health card. We found this intervention extremely valuable. We used it during the measles campaign and in our ability to be able to quickly identify and track down all contacts of suspected cases. In a sequential manner and guided by the expert health advisor on the global pandemic, the Department of Immigration placed border restrictions that banned the entry of non-citizens into the country, initially from China, then eventually from all parts of the world, whilst Fijians were exempted. Those returning from these countries were required to undergo a 14 days quarantine at the government-designated quarantine centers. These measures were subsequently followed by the banning of all cruise liners from entering Fijian waters and docking at any port in Fiji. The international airports and seaports were shut down on the 26th of March 2020, and only returning Fijian citizens and international trade remain open. We are now 1 year from the date. Following the community transmission, members of the discipline forces joined the Ministry of Health and Medical Services to assist in contact tracing and community surveillance through fixed and mobile fever clinic in each division. The mobile fever teams conducted house-to-house visits, reaching 97% of the population. This massive undertaking has become a feature in the whole of government COVID-19 surveillance response and is a testament to the truly national coordinated response to the pandemic. A major marker in our success in this fight is the ability to do COVID-19 testing locally. Fiji commenced testing for COVID-19 at the Fiji CDC on the 11th of March using the molecular-based real-time quantitative reverse transcription, or PCR, RT-PCR in short. This is globally recognized and approved standard of testing for this virus. Our testing capacity was further enhanced with the introduction of gene expert testing capability, also a molecular-based test, but with a shorter turnaround of less than 1 hour for results. This has enabled Lautoka and Labasa, as well as the Central Division, to increase its community surveillance through the gene expert test kit. And Honourable Speaker, this is important. When we say there is no community transmission, it's not because of the people that we test in border quarantine. It is because of the number of tests that we're doing outside of border quarantine. We're testing those that present with cough into the health centers, those who are admitted with pneumonia. We're randomly testing our staff right throughout Fiji, and that's how we know there is no community transmission of COVID-19. Our quarantine facilities were busy from last year, And we've identified key isolation centers and 17 facilities to provide surge support for COVID-19 if required. Today, there are 855 Fijians who have recently arrived into the country and undergoing their 14 days of mandatory quarantine in government-designated border quarantine facilities under supervision. The government has been forthright and transparent with information on COVID-19, with regular press conferences to update the public on the progress of the disease in Fiji and the response measures implemented. We developed a comprehensive communication plan, which included a community awareness package on COVID-19 that was delivered to 100% of the villages and settlements in Fiji. All media outlets were engaged through media releases, press statements, press questions, social media posts, frequently asked questions, posters and videos. Then included one by the Fijian Men's team. Through the Ministry of Commerce, we also put in place a toll-free number which has received nearly 10,000 calls, averaging 150 to 200 calls per day in the initial phases. Apart from that, we have our contact tracing apps, where the availability that we have, the Care Fiji app, and also the case management tool SOMAS, which we have in place. I can go on to describe the commitment government has towards ensuring that COVID contain Fiji, and it surely comes with a sacrifice of many dedicated and loyal Fijians, including the disciplined forces, frontline workers, and the staff of the Ministry of Health and Medical Services. I also pay the respect to the Fijian government and the Honourable Prime Minister for the immediate decisive actions from the initial stages through many policy decisions, budgetary supports, and nationwide actions. And as I speak today, we are most probably the only country in the world to have had COVID containment for more than 330 days. Our attention is now focused on the major vaccination campaign ahead of us. The COVAX facility, initiated by WHO, is allocated to Fiji 100,800 doses early this year, a portion of the 20% which is committed to Fiji. Of this, we received the first batch of COVID-19 vaccine on the 6th of March, 12,000 doses of the AstraZeneca Oxford vaccine for 2 doses each for the target 6,000 individuals. The months of April to May will see the additional 88,800 doses arriving. Thus, before June, we can anticipate that the country's frontliners and other vulnerable individuals with comorbid issues would have been vaccinated. Fiji has developed and submitted its national deployment and vaccination plan, which had started in November last year. This plan is comprehensive in its document outlining 1, the regulatory processes, 2, the target population, 3, the phased out approach, 4, the cold chain systems in place, 5, supply chain and healthcare waste management, 6, effective vaccine management, 7, the digital platform with both the registration and monitoring system, 8, the systems and processes of any adverse event following immunization, 9, the monitoring and evaluation of the deployment and vaccination, 10, human resource management and training, 11, diseases surveillance, 12, communications, and 13, financing. And because we did it and answered the forms and we filled it in comprehensively and we presented it to COVAX, is one of the reasons why we were the first country in the Pacific outside of the US territories to actually receive the COVID-19 vaccines. This planning has taken place in all the 4 divisions, with a significant amount of micro-planning specifically for the arrival and deployment of vaccines to the monitoring. While this level of planning has taken place, a significant amount of work continues to instill preparedness and anticipation in our vaccination teams as we get closer to operationalizing the deployment. The initial planning has involved non-governmental organizations, faith-based organizations from all spheres, and as we speak, we continue to develop relationships and work together this one common goal of protecting all Fijians from COVID-19 when the borders open. Thus, as a ministry, our target are as high as more than 95% of all eligible individuals, which is individuals above 18 years of age. And I thank the honourable members of the House who have registered and showing leadership and responsibility as we move forward with the vaccination program. The first 6,000 frontline workers have been from health, all of the Western health staff, the other frontliners from the central and northern divisions, including the Blue Lane personnel, to start soon in Sub-South. The sea and airports, hoteliers working in quarantine facilities, and a few other associated individuals who work closely at the ports of entry, including our defense forces. The deployment of the first batch of vaccines has provided an excellent opportunity to test our plan identify potential gaps in our processes, and put measures in place to address our systems and processes before the bigger vaccine deployment exercise commences. We vaccinated 6,278 individuals in the first batch, as some vials had more than 10 doses. These are often done by manufacturers to mitigate against wastage during vaccination. Our vaccination teams were very efficient in making the most of this opportunity to vaccinate 105% of our target population of 6,000. I'm pleased to inform that a total of 4,821 individuals have been vaccinated in the Western Division, 1,137 in the Central Division, and 320 in the Northern Division. I'm also happy to report, Honourable Speaker, that out of the 6,278, there were no adverse events following immunization. Some individuals developed mild side effects which were temporary and adequately managed with symptomatic care, which included antibiotics such as Panadol and hydration. As per our vaccination deployment plan, Honourable Speaker, the next batch of vaccines would target the rest of the healthcare workers across Fiji, including private practitioners across Fiji. Apart from this targeted population, we want to protect next our most vulnerable population, which are those individuals with comorbid conditions such as diabetes, hypertension, cardiac issues, renal diseases, etc., including persons with disability. Honourable Speaker, how it works. When you register onto the online registration platform, it does ask you if you have any comorbid illnesses, including, for example, high blood pressure, and you then indicate that there. You may wish to actually put in your national health card number. And what happens is on the back end, our staff, the data managers, go through that and begin to pick out those who are in the vulnerable groups. And then you will receive your invitation by text. That's how it works. So that's how they do. So the data managers that are sitting behind go through the detail and identify the groups as they come next. So as you maybe have seen in the papers recently, last week, we were told that we were next on the list, so we just went and had our vaccination done. So apart from this, we're also anticipating on vaccinating at least 145,400 individuals in the coming few months. While we focus on this target population, we're also working to ensure vaccines for all individuals above 18 years old in Fiji. This is required for at least 650,000 individuals, which equates to 1.3 million doses of the vaccine. And apart from COVAX support, which covers the initial 20% of the population, the government is also actively involved in bilateral and multilateral discussions with partners who are willing to support Fiji in acquiring initial doses of vaccine for the rest of the population, and also in places where Fiji will actually acquire using its own appropriation. The government and the ministry following closely the processes for approval by WHO for the other vaccines in a not too distant future. To conclude, Honourable Speaker, the resident coordinator for the UN, Mr. Sanaka Samarasinha, provided an excellent perspective of our efforts a few days ago when he said this: Fiji and the Pacific's handling of COVID-19 is one of the best kept secrets that I know of. It really is an amazing story, in some ways not surprised. But I'm disappointed that Fiji and the Pacific countries that have managed to contain COVID for so long have not got the credit, and the people have not learned their lessons from this country. And look at us. We are able to walk around and not wear masks. We are happy with what we have achieved as a nation so far, but we are not resting on our laurels. We remain vigilant, focused, and we will not lower our guard soon, because the virus is still pandemic. The virus continues to mutate in countries that have never had mutation before, despite vaccination having begun. There is some light at the end of the tunnel, but the end of this pandemic for the world is still out of sight. Our experience so far have taught us that when we come together as a nation, rally together, a whole of society and whole of government approach, and we commit to act together and respond in the same way, with the same fervor and commitment, we can overcome the global threat and any other threat that stands in our way. I thank the Honourable Prime Minister. I thank the Honourable Cabinet Ministers, the civil servants, and the many others in the community, including members of this August House, who showed leadership and responsibility with us. I thank all Fijians for your effort in keeping Fiji COVID-19 contained. We cannot drop this ball. We must continue. And I ask you to stay with us as we complete this difficult story. I thank you, Honourable Speaker.